Good morning, everybody. Welcome to this meeting of the South Yorkshire, Derbyshire and Nottinghamshire Joint Health Overview and Scrutiny Committee. I have a few housekeeping notices before we begin in earnest. Can I request that mobile telephones and other such equipment are switched to silent mode so as not to disturb the conduct of the meeting. There's no fire test planned for today. If there is an emergency evacuation or alert, please take instruction from the council staff present, and the assembly point is outside in Tudor Square. The meeting today is open to the public and will be streamed live and for subsequent broadcast via the council's website. You should be aware that the council is a data controller under the Data Protection Act. Data collected during this webcast will be retained in accordance with the council's published policy. By entering the meeting room, you are consenting to be filmed and to the possible use of those images and sound recordings for webcasting. First of all, apologies for absence. We've had apologies from Councillor Warmby this morning. We have members from Doncaster, Rotherham and Barnsley here, and officers in attendance, and our guests from the Integrated Care Board and Yorkshire Ambulance Service this morning, so welcome to everybody. If I could just do introductions, we'll go around, first of all, the elected members who are here, and then we'll go around again for everyone else to introduce themselves, if that's all right. So I'm Councillor Ruth Milsom, Chair of this committee and Chair of the Health Scrutiny Committee in Sheffield. And we'll go around this way to Tiber.
Good morning, everybody. My name is Tyber Yassin. I'm a councillor for Rotherham, and I'm also the chair of Health Select Commission. Nice to meet you all.
Good morning, everybody. My name's Glen Smith. I'm a councillor in Doncaster, in the city of Doncaster, and I'm the chair of the Health and Adult Social Care Scrutiny Committee.
Morning, Chair. Councillor Jeff Ennis, Chair of Barnsley's Overview and Scrutiny Committee. Thank you.
Thank you, members. And then if we can have officers introduce themselves as well.
Apologies. I'm Catherine Harkler-Road. I support Councillor Yassin on Health Select Commission.
Good morning, I'm Christine Rothwell. I'm from the City of Doncaster and I support the scrutiny function at Doncaster.
Morning everybody, my name's Jane Murphy and I'm the Scrutiny Officer from Barnsley, supporting Councillor Ennis this morning.
Joan Cooper, Democratic Services.
My name's Deborah Glen. I'm the Policy Improvement Officer for Sheffield City Council.
And our guests who are with us today, thank you.
Hello, my name's Adam Layland. I'm the System Partnership Director for Yorkshire Ambulance Service.
Morning everybody, my name's Cleary-Gray. I'm the Exec Director for Strategy and Partnerships for NHS South Yorkshire.
I'm Katy, Davison, Deputy Director of Involvement for NHS South Yorkshire.
Morning everyone, I'm Marianna, Hargreaves. I work in Strategy and Partnerships at NHS South Yorkshire.
Great, so welcome everybody. We have no items this morning for the exclusion of public and press, and I'm to ask if any members need to declare any interest they have in the business to be considered at this meeting. None? Thank you. So we'll go on to the minutes of the previous meeting, which is in your agenda pack, page 3. Now, Councillor Ennis and I are the only members here today who were present at that meeting. So it falls to us, Councillor Ennis, to approve the minutes.
In that case, I ought to approve the minutes, Madam
Thank you very much. Seconded. Thank you. Noted. And then we can move on to item 6, which is the updated terms of reference, and our Policy Improvement Officer, Deborah Glen, will introduce this item. Thanks, Deborah.
Thank you, Chair. A fairly straightforward paper. Essentially, the terms of reference of the committee needed amending in light of the changes to the NHS structures, the recent changes to NHS structures. It used to have a reference to the CCGs, clinical commissioning groups, and now refers to the new structures under NHS South Yorkshire. So it's really for members to note those changes and agree the revised terms of reference.
Are members acquainted with that updated terms of reference? Are we happy with that, or do you want a moment?
I'll move those changes. I'm happy to, yes.
Are we happy to accept those? Yeah, thank you, members. Brilliant. Thank you very much, Deborah. And so on to item 7, which is relating to developing the NHS 5-year joint forward plan for South Yorkshire. Welcome again to our guests. And I think, have you brought a presentation for us? So thank you for the report that you've sent in, which is really informative. And so if you can perhaps just give us some headlines from that and any points that you want to draw attention to, and then I'm sure members have got a lot of questions.
Thank you, Councillor Mills. If it's okay if I just give a few words of introduction, because my colleagues Marianna and Katy will talk you through where we are in terms of the development of the joint forward plan, and particularly around the engagement works. I think Scrutiny were quite interested in where we'd got to with the engagement work. I think from my perspective, just in terms of introduction, is just, I mean, we are, NHS South Yorkshire, as you know, is a relatively new organisation formed out of the Health and Care Act in 2022. And we've just heard the update to the terms of reference in relation to CCGs, because NHS South Yorkshire actually is the new organisation that's formed out of that. So in terms of role and responsibility, very, very similar, but a South Yorkshire organisation. I think one of the things that I wanted to highlight, I think it's quite important for South Yorkshire, is the sort of the nature of how we've kind of established that organisation. So built on the work that previously our CCGs did in conjunction with our wider partners in each of our 4 places. That becomes quite important because the nature of the plan, as you see, is based on how we've organised ourselves, how our communities are embedded across South Yorkshire, and therefore our plan very much tries to build on that work. When we go through the plan, you'll see that we very much make reference to the work that we've been doing with our wider partners as part of our integrated care partnership. So part of the changes was to establish integrated care partnerships across England, and we've obviously established one in South Yorkshire. The members of that are, as you can imagine, all of the statutory partners across health and social care, so our 4 local authorities, our combined authority and the NHS, but very much so our wider partners, including universities, voluntary sector as a strong partner within that space too. The reason why I wanted to reference that is because the joint forward plan, in terms of what we're asked to do, is to ensure that we reflect the ambition and the vision and the priorities that are set out in that strategy. So it is met directly to the Integrated Care Strategy for South Yorkshire, which was published earlier this year. So hopefully you'll be able to see some reflection of that. The other thing that it absolutely is meant to do is respond to the needs of our communities. So absolutely based on a joint strategic needs assessment and a revision of that specifically for the joint forward plan. And then the third and final thing is responding to the mandate from NHS England in terms of the expectation that we are expected to respond to in terms of those core commitments from the NHS mandate. So I just wanted to reflect that, because I'm mindful that there's differential knowledge around the changes, and therefore it just sets the context for us. Thank you.
So if it's okay with everybody, what I'd like to do is just take you through a little bit more detail, and then my colleague Katy is going to share with you more around the engagement approach and what we learned from that and how that's kind of further influenced and shaped the plan. And then we'll look at some of the kind of key areas of focus in the plan. So, and I'm in control of the slides, which is always great, isn't it? So I thought it'd be helpful just to have a little bit of context around the landscape that we have been developing this plan in over the last 12 months. So there was an ask of us with our partners to develop an integrated care strategy. And if you remember, when you came together last time, we actually had quite a detailed look at that integrated care strategy for South Yorkshire, didn't we? And we talked about the kind of key areas of focus in there. And then the NHS 5-year joint forward plan, there was a more specific ask for NHS partners to come together to develop a plan, and that was alongside our kind of annual operational planning ask. So rather a lot of asks around our strategy and planning, and that's the kind of context, I suppose, that we were kind of taking this forward in. So the integrated care strategy, we talked about that in quite a lot of detail last time, the vision or the working vision that we described together, which was around everyone in our diverse communities having a happy, healthier life for longer. And we'd set out a range of shared outcomes, which were those that were identified across each of our health and wellbeing boards. And together we identified some specific areas of focus that we described as our bold ambitions. And they were around children and young people. They were also around accelerating our approach around prevention. They were around looking at how we increase economic participation and looking at our economy. They were also around how we support our workforce. And the reason I've kind of reiterated those is because what we have worked hard to do in the plan is actually respond to those. And so that actually we're looking at how can we make a good NHS contribution towards the delivery of those, working with our partners. So the joint forward plan ask, I thought it'd be helpful to just give a little bit of context about what the national guidance set out that we should include in our joint forward plan, because it was a bit more prescriptive than the integrated care strategy. So the ask of a joint forward plan is that what it sets out is how we will arrange and provide NHS services that meet both the physical and mental health needs of our population. It needs to respond to the joint strategic needs assessment, so that's the needs assessment that we started to bring together to inform our integrated care strategy, and we're refreshed in order to inform our joint forward plan. It needed to align to our health and wellbeing strategies and our place partnership plans. It needed to ensure that it responded to the NHS universal commitments, and what it means by those is the things that were set out in the NHS long-term plan. So the things that were set out as things that we should take forward through there. It needs to help us to demonstrate how we're going to deliver the core purposes as an integrated care system. And the core purposes there, it's about how we will improve population health, improve healthcare outcomes, how we will address some of our inequalities in access, experience and outcomes, how we'll think about productivity, value for money, and then how we'll contribute as an NHS to that wider social and economic development. We needed to also ensure that it was in line with and brought together as a shared delivery plan for our integrated care strategy, and that it would support us to dispatch the legislative requirements. And in the papers that you got, there was a list of the legislative requirements that we needed to consider in terms of bringing together our joint forward plan. So that was how the national expectations were set out around the plan. I'm going to ask Katy now, she'll just take us through one of the key areas of focus, which was our engagement activities that informed the plan.
Thank you. So I'm just going to start, this slide's a bit of a reminder really, because we did come to the last meeting and talk about the involvement approach that we'd taken for both the ICP strategy and the joint forward plan. So if I start at the bottom of the slide and do it chronologically, the first thing we did before we started our work for the ICP strategy was to look at what we already knew. Our communities regularly tell us not to ask them the same thing, so we analysed 284 pieces of recent involvement work that had taken place across all of our partners that gave us any intel on some of the key themes that were affecting our communities. And then we spoke to another 500 people on top of that, what we did, I know when we came to the meeting and in our conversations, I know this committee felt that 500 wasn't a big enough number, so we took stock of that and looked at how we could take a different approach to our JFP involvement. One of the key things we did from the outset was work with our health watchers to commission them to deliver involvement work for us, particularly with our seldom heard communities. Let's move on to the next slide. So this slide gives you a bit of a feel for how the different involvement approaches that we took and the responses that we got from them. So as I mentioned, we worked with the health watchers. We had early conversations with them about the number of people they felt they could access in the timescales we'd got. We worked with them on the lines of questioning because they're the people with the expertise in that. And we feel that it was largely a successful approach to making sure we heard from our seldom heard communities. I have had I've attended a Health Watch debrief actually this week on Monday for 3 hours, looking at how we can do this even better next time as well. So we've got some really good ideas in such as things like co-producing the questions with the involvement officers from the Health Watchers and people with lived experience. The second thing that we did was the public survey, and again that was following on from the ICP approach. So the public survey approach is obviously one of the ones we go to early on because it's a free approach for us. That involves putting things on all of our social media channels. It involves asking all of our partners, local authorities, trusts, etc., to share our ask on in their mechanisms, which is both social media and newsletters, bulletins, that kind of thing. We also took on board the feedback from this committee last time, so that was sent to the member services teams and asked to be circulated to the councillors as well. What we did do though was make sure we were responsive to the feedback that we were getting, so we saw the usual sort of steep incline in terms of people responding, and then that levelled off very quickly at sort of the 120 number, which is obviously not what we were hoping for in terms of numbers. So we were responsive to that and we tried to change our approach. We changed the narrative. So we tried to be as engaging as possible. So we took what we'd already heard from people around things like not being able to get GP appointments, and we made sure that our communications sort of used that as an incentive to try and get people to respond. We paid for some social media advertising. We tend to go to that one quite early on because it's actually not very expensive in terms of reaching a broader number of people. What we found was that still wasn't particularly getting in the numbers. We find with things like strategies and plans that engaging people is quite difficult because people see it as something that's quite distant from them and not as relevant to their daily lives. So, for example, when we do things about GP practices moving and that kind of thing, it's much easier to get the numbers because people can see how that really affects them. So we took a number of additional approaches at that stage. We worked quite closely with the trusts to make sure that we heard from a larger number of our huge NHS workforce in South Yorkshire, recognising that as well as being our workforce, many of them will be South Yorkshire residents as well. So we did a bit of a competition type exercise with the trusts, trying to engage them and let them know each week who was winning in terms of how many of their staff had responded and that kind of thing. And then the other thing that we decided to do was pay for some on-street involvement. So we commissioned an organisation that specialised in that kind of thing. We commissioned them to hear from at least 1,000 people. They also look at the demographics of South Yorkshire when they do that, and they position themselves in places that means that the responses should be demographically reflective of South Yorkshire. I just wanted to say on that as well, if you've read the involvement report, you'll see how the analysis has to differentiate between the on-street responses and the rest of the responses, and that's to do with the fact that we have asked open-ended questions largely in our involvement, and the advice from the company who do the on-street type involvement is that multiple choice questions work much better in that arena because people have less time when they're stopped on the street. But what they did was use the answers that we'd got from the rest of the feedback already from the staff and from people who'd responded and from the seldom heard communities to make sure that the multiple choice answers were reflective of what people were telling us. So before I move on, just to say quickly again, as I've mentioned before, I met with the health watchers on Monday around a debrief. We talked about co-producing the questions next time. What their workers also said to me, their involvement officers, is that they feel that having a differentiated approach to the lines of questioning in the future would be the right thing to do as well. So they found that some of the questioning was quite challenging in their focus group type scenarios, and so they've got some really good ideas for how next time, if we do say a survey and we do focus groups, we have some different approaches that would then be analysed separately, but we would be able to see the similarities across the two. So this slide just takes you through the breadth of some of the groups that were reached by it was actually the 3 health watchers in the end, Sheffield, Barnsley and Doncaster health watchers and Voluntary Action Rotherham, because the health watch in Rotherham didn't have the capacity at the time to support the work, so we engaged with Voluntary Action Rotherham instead. But hopefully this gives you a good view of all the different approaches that we took and the different groups that were reached. And again, this is in the report, so if you want to have a look at that in more detail. Oh, and that's very small, sorry. I did just want to give you a bit of a snapshot of the demographics, so you could have a look at, and again, this is in the report, some of the different cohorts of our communities that we reached. Gender, I think you'll find that that's reflective of the fact that the on-street survey, it was commissioned to be demographically reflective, because what we typically find in self-select involvement is that it's much higher proportion of women that respond than men, and obviously it's fairly equal there. Age, I just wanted to mention, obviously that starts at 16, and that's to do with the surveying young people and the consent issues, and that being difficult in sort of the traditional involvement mechanisms. But what we do have in South Yorkshire is a really good children and young people's partnership who are taking a really positive, active, proactive approach to involving children and young people. They've sort of co-produced that from the very outset, working with young people about how they want to be involved. And so we had to be mindful of their approach and not undermining that. So what we did with those is work with the Children and Young People's Partnership to make sure we heard what they had been hearing from young people recently and incorporated that. And then the final demographic slide is just about the ethnicity. And what we've done with this one is pop the percentage of the South Yorkshire population on the right-hand side, just so that you can see however many people we've reached and how that is reflective of our population. So I think we're quite pleased with that approach, because we've found that the work with the health watchers to reach into our seldom heard communities has meant that this isn't massively weighted towards the white British community, which we do tend to find in involvement when we don't engage more actively with our seldom heard communities. So finally, the things that we heard, obviously we've heard from more than 2,500 people, and again, if you read the involvement report, you'll see in some more detail what some of the themes were from the different groups and from the different survey mechanisms. But this is a bit of a concluding overview of the sort of the 3 overarching themes that were coming out of all of the mechanisms and the participants. Sorry, I can't speak. And again, if you remember from my presentation last time around the ICP strategy, it's probably unsurprising to you to see that 2 of the 3 themes are the same. So accessibility, I can't imagine that's a surprise for any of you, because I'm sure you hear it from your constituents all the time in terms of being able to access their GP practice and also how accessible they feel that health services are to them. Agency, again, is about people feeling that they can take control of their own care and that decisions aren't being made for them, and they have the access to the tools and the information to be able to manage themselves. And then the final theme, which is different and I think is reflective of the time we're in and speaking to a broader range of people than we did with the ICP strategy, is affordability. And obviously, like I say, I don't suppose, again, that's a surprise in the time that we're in. What we have done, and this has been done since we submitted the papers for this committee, so apologies you haven't seen this, but I have put the link on there and can circulate it as well. I've popped this on the website so you can have a look. We've done a You Said We Committed, because what the Health Watchers said to us was, we want to go back to the groups and we want to tell them how what they've said to us has influenced what's in the plan, because they can't instantly see it. And that's because we've not taken the approach of, this is what people said and this is what we've done, and whacked that in. We've tried to make sure that what people have said is throughout the plan. So we've done this You Said We Committed document so that we can explicitly pull out some of the key themes that people said to us and where they can find references to that within the plan. There is still work to be done on that. At the moment, as I've said, I've put it on the website essentially so that you guys can see it, and it's gone to the Health Watchers for them to share with their community groups. But it's not particularly accessible for the wider public, and we do need to do some work on that and making sure it's something that's visually appealing and people can really clearly see how their feedback has been taken on board. And then the final thing we've done is, since the draft has been prepared, we've put that on our website. We've let people know. Marianna's led on the stakeholder involvement in terms of making sure all of our partners have had the opportunity to give their views on the draft plan, and we've been making sure that any public who would like to give their feedback have got the ability to do that. That has recently closed, and Marianna can share a bit of detail about the feedback. But again, I just want to reflect in this committee the conversations that I had with Health Watch on Monday around deadlines and this being quite tight and it being the school holidays, and sort of our commitment that we will, wherever possible, work with our Health Watchers and our partners to make sure that you know, we give people as much time as possible to be able to feed back to us. Do you want to say something about the feedback?
I can do. So in terms of over July, we took the opportunity for the engagement draft to be out there, and we have had feedback from a number of members of the public, from Health Watch, and from some of our partners, particularly some of our local authorities. And in terms of the types of feedback that were coming through from members of the public, what we've had is ensuring that we're learning from what's worked well in the past. We've had more of a specificity around things like early help, so being a bit more specific around that in terms of prevention. We've also had some specific feedback around accessibility for those with physical and learning disabilities. And so I'm in the process of looking at how we reflect some of the feedback in terms of what edits we make to the joint forward plan, but also in terms of feeding back to some of our programme and project leads around what some of that feedback has said to us. From Health Watch, particularly Health Watch in Sheffield actually, that gave a really detailed piece of feedback recently. They felt that the areas of focus in the plan did reflect some of the areas that were identified in their involvement. There were some concerns raised about the overall deliverability of the plan, and we kind of we echo that as statutory partners. It is a broad, challenging plan, and also around the extent to which we've got quite a large range of outcomes that we've articulated in the plan, and the need for us to ensure that we are specific and measurable in our approach to those. So we are on with some work to develop and expand our outcomes framework, which will help us to be able to do that. And then from our local authority partners, we had feedback around the fourth purpose of the ICS, so particularly thinking about how do we strengthen the focus throughout the plan around how the NHS can add value, not just in its way it arranges and delivers services, but in the way it is a large local employer, in the way that it procures its services. So really fulfilling its role as an anchor institute and making some of the connectivity in the plan between our kind of workforce, procurement, and the section that you've got there in the anchor institution. So it was brilliant feedback, in terms of us being able to have an opportunity to take a step back and strengthen some of the elements of the plan. So I am on with now looking at what that means in terms of making some changes to our joint forward plan, but I'm also looking at, what does that mean in terms of how we feed back to people that are involved in the delivery of the plan as well. So that's a little bit of where we're at with the feedback that's come in over the last kind of month. But I'm just going to take us back a little bit to the development of the plan. I will speed up, I promise. So as well as the engagement activity and what we've learned from that, we've very much looked back at our needs assessment, and there's a link in both the joint forward plan and the integrated care strategy that's available online. It's a really interesting read, but in essence what that tells us is that we know that people live shorter lives in South Yorkshire and longer in poorer health, and that actually that some groups that we sometimes describe as health inclusion groups fare particularly worse, and that we need to kind of focus on that, and that actually the health status in South Yorkshire is not as good as it could be, and that some of our inequalities, the gap in our inequalities is widening. Yeah, so that was another kind of really strong influence in terms of, well, where do we focus our plan? There was also an acknowledgement that we have got a lot of challenges. And so we illustrated that in the front section of the plan with some challenges around delays in A&E, so some of our experiences with the kind of ambulance handovers. We also have a number of challenges around mental health, so we illustrated that with our mental health out of area placements, but of course we know we've got challenges in terms of waiting lists for children, young people and adults in that space. Our elective waiting lists, so thinking about challenges in terms of accessing planned hospital treatment and care, and then primary care challenges. And this was quite a difficult one to illustrate because we know that we have increased our number of kind of GP appointments, but we know that demand is really high, and that's an area that both from our engagement work and from our workforce that actually we've got some real challenges to think about, how do we improve access for people to primary care. So we set that out early on in the joint forward plan. And then what we did was we took what we're describing as a distributed leadership approach, which sounds a bit posh, doesn't it, really? But what we mean is that we identified the people that are expert leaders in their fields to support us with the development of the different components of the plan. And we brought that together. And we identified a number of what we're describing as objectives, which really are areas of key focus across the plan. So things that if we focus on these across the breadth of the plan, we know that they will help us to deliver the plan. And that's about ensuring that we take a preventative approach, that we focus on things like access and quality, which is some of the key themes that we heard were really important to people that live in South Yorkshire, that we, where possible, maximise the use of digital data intelligence, and that actually we look at kind of research and innovation and how that helps us to drive things forward. That we work together in terms of partnership and collaboration, and we make best use of our resources, and that we support our workforce. So they were our key objectives. We did some further work around phasing of our plan, so ensuring there's an immediate focus on how we recover services, and we do that in an equitable way, and that we continue to take a preventative approach and work with our wider partners, so particularly relevant in terms of our local authority partners in relation to the kind of wide determinants of health. Within the joint forward plan, you'll see that there is a plan on a page, and what that does is describe some of the more specific key areas of focus throughout the plan, and you'll find that there are sections then on each of those. So in there what you will find is that there's a section on improving maternity and addressing the needs of children and young people. There is a section about improving access to primary care, and that's in its widest sense. So thinking about all of the contractors that support delivery of primary care, GPs, primary care networks, community pharmacists, dentistry, optometry, transforming community services, so how we support people well in the community. And in there what you'll find is that there are plans that are supporting the ongoing development of our integrated community teams, expanding some of the new developments we've got like virtual wards, and thinking about how we take a preventative approach in our work there, but also have urgent community response in the community. Recovering urgent and emergency care, and that includes thinking about A&E processes, but also that kind of discharge and how we link back into community services. Recovering our elective and diagnostic and cancer pathways, so access to that planned care, And then from a mental health perspective, how we improve access to our mental health services, both children, young people and adults, and again for those with learning disabilities. So each of the plan actually goes through each of those and some of our key areas of focus over the next 5 years. It also has a specific focus on the outcomes, and there's more detail on that in the actual plan. It's my last slide, which was really about next steps, and the only thing that was going to say that we're working really hard to take into account the feedback that we've received over July, and that includes the feedback that we receive here today, so that actually what we'll be able to do is to consider that alongside the feedback that we receive more broadly, so that we can look to finalise the plan in early September. Is there anything else that we need to add? Apologies, that was quick, folks, wasn't it? But I am really happy to answer any questions that you have.
Thank you very much indeed, all three of you, for running us through that. And what we've done is, in our discussion around the report before today, we've themed some questions. I think you might have a copy, which hopefully will guide our discussion and avoid being too scattergun. So we're going to run systematically with these themes. I'm going to ask members to be really succinct in your wording of your questions, and I know that's frustrating, and just to say that if we feel we've seriously run out of time today, you know, there is the future. So don't feel we've got to cram absolutely everything into today. Let's be thorough in what we want to discuss, but if questions and answers can be as concise as possible. And before we go into questions, I want to say a huge thank you for, it's just a monumental amount of work, and some of our questions may, you know, probe into methodology or intentions or outcomes, but I think we all appreciate the vast amount of work that's gone into this in a very short time, and how very, very difficult that's been. So please put our questions in that context. So I think our first point here is about the role of elected members, and I'll quickly whiz through that, because really our conversation was around the fact that elected members are not widely represented throughout the integrated care system. We have a member per authority who sits on the Health and Wellbeing Board in each authority, but apart from that, we're not really represented within the system, in that, you know, we have constant input. And I think we wanted to highlight, as a group here, the fact that we do have quite a unique perspective on our communities, and that our insight into our communities is perhaps something that you could draw on as well. And I know it's difficult to mobilise members. You send an email, please can you share this, a survey, please can you interact with this, and we're all busy, but please do keep trying to use that resource that you've got of people who are representing communities and often know them very, very well indeed, and please do draw on that. And this committee, we have scheduled a lot more meetings than in past incarnations of this committee, so again, use the resource that's there, please. So our first main topic here is consultation, and if members want to raise questions around that topic. Councillor Smith.
I mean, I think we've talked about it already, about the really very poor response rate, and I suppose one thing I'd really be interested to know is, as a result of any consultation, has anything ever been done any differently?
Yeah, I think we try to be responsive. I think, as I said in my presentation, we learned some things, I think, from the ICP strategy involvement, and we tried to enact them with the JFP involvement. So we are always trying to learn and trying to take new approaches to involve people. I think, as I said, it's really challenging on strategy and plans because of the lack of human connection. Really, it's, you know, I think to many of us in the public, it feels like it's happening over there. So we did try and with the comms for this involvement try and really connect to people, but you know, it's just a really tricky thing. But as we've said, we've identified that the work with Healthwatch is a really good way of reaching some of our seldom heard communities, and I think some of the questions are also around how we reach into communities where English is a second language, and we very much work with Healthwatch and the voluntary community sector to make sure we do that. But also the on-street survey is a really good way of making sure that we just get people who otherwise might see these opportunities and just think, I haven't got time for that, and sort of doorstepping them as they're going about their daily lives does tend to work a little bit better. So yeah, we're very much learning and sort of picking up from Councillor Milsom's last point. You know, we have just taken the approach of emailing the elected members and asking them to share with their communities and share their feedback back with us, but really keen to learn, you know, if there are other ways that we could be doing that in a more engaging way, and how we can take that on board for future involvement. But yeah, absolutely, we try and learn and evolve, definitely.
Did that answer your question, Councillor Smith?
Could I just, because I think the straight answer is yes. That consultation does influence what the NHS and others does. We are a relatively new organisation as NHS South Yorkshire. It's difficult for me to say, well, what have we formally consulted on, and there, what for the changes? And I think the only one that springs to mind in the lifetime of a year of NHS South Yorkshire is the sites of new practices in Sheffield, where that was a formal consultation process, and you know, listening to the public and actually you know, really making sure that that was reflected in the end result. So but I guess the bit I wanted to reference is Katy made the point around it's quite difficult when you're sort of engaging and consulting on a strategy which is relatively high level. And I think the reference I wanted to draw on, I think this feels really important, that it doesn't end. So the engagement and the consultation, and I use that word quite specifically, doesn't end. So we started in this round engaging on a strategy, and then we continue that engagement on developing a joint forward plan. As we start to get more detailed in the delivery of those, the engagement and, where that's appropriate, the consultation will continue. And it absolutely is the endeavour of NHS South Yorkshire for that consultation to be meaningful and therefore influence the outcome of any potential changes. So I'm trying to give you a bit of a sense of the commitment of NHS South Yorkshire, but the reality is that we're a relatively new statutory organisation.
Councillor Ennis.
Yeah, thanks, Chair. Can I first of all underline your comments in terms of the amount of work that's gone in by the officers concerned? I think we've done a fantastic job. They've obviously had a very steep learning curve in terms of consulting with the public. But in terms of trying to even improve the system even more, we've obviously made the point about the voice of social care providers needs to be harnessed more, and I'm thinking now particularly about the private care homes rather than the council homes or whatever, because they sometimes feel excluded, for want of a better expression, shall we say. And the other point I wanted to make was in terms of social housing providers and getting their voice. In Barnsley, for example, we've got Burnsley Homes and St Ledger Homes in Donny, etc., etc. And I think we need, and quite often these are catering from, these social housing providers are catering for the people who are excluded, for want of a better expression, who have got problems, etc., etc. And I think it would be useful to give them more of a platform as well, Chair. Thank you.
Thanks, Jeff. Councillor Yassine.
Thank you, Chair. I think when I look at reports like this and the agenda about how NHS services will be delivered, the Integrated Care Board is such a substantial structural change. And I think because it's such a significant change about how we're going to do healthcare business, nationally and regionally. I just feel the onus upon us in terms of our responsibility about how we undertake engagement, it should be a top priority. I appreciate the effort, and I do believe this because I have a lot of evidence, not just because I'm a counsellor, well before I was a counsellor. People underestimate how hard it is to do real meaningful engagement. It actually requires investment. I know that we rely upon Health Watch. The history of Health Watch actually wasn't to do this kind of consultation. Its history was people are not happy, need support in navigating a system, something maybe not gone right for them, to go to Health Watch for support and assistance. So I think I do believe that Health Watch has a vital role in supporting consultation, but I think yourselves and wider councils and partners need to actually invest in that infrastructure if we want it to do what IPOS Mori does. You know, this is a 5-year plan. So for me, that should have been a high-level priority about how do we educate local people about these changes, not just what do you think about some of the things that we come up with. A simple question is, what do they want from the NHS? What would it need to do for them to feel healthier and live more active, happy lives? You know, and I think we need to rethink engagement. I wouldn't solely put that upon your shoulders. I think it's a wider responsibility for statutory services, and I have to say that we're failing in that collectively.
Councillor Smith.
Yes, the other thing, the point I wanted to make, and I'm going to own up, I worked in the NHS for 50 years. So I'm not speaking from without knowledge, and is about the voice of the vulnerable, and I'm a learning disability nurse. So my concern is, I hear all you're saying, I hear what the council has just said about the responsibility we're giving to Health Watch. Because I don't think necessarily they're the experts at producing information that is easy to understand by people, not just with a learning disability, the elderly confused, you know, dementia, autism and everything else. And I think we need to be very much more careful about how we do information that we give to those individuals. In my experience, good easy read isn't just used by people with a learning disability, it's used across the board. And so it needs to be good. And I've recently had an experience with Health Watch and some easy read, which was probably the worst easy read I've ever seen in my life. And what I would ask is that we take some advice from the learning disability teams and also SALT, so that we produce the information that people actually can understand. Otherwise, it's a pointless exercise. I love the bit you said about lived experience, and you know, we've been doing that for many, many years in learning disabilities, and that's really important, but we have to use the right information and it has to be produced so that it's going to be used. And I also note what you said about the on the street and about multi-choice questions. If you give somebody who isn't understanding your questions multi-choice, I'm here to tell you they'll pick the last one you said. So we need to be more skilled at those methods of questioning and how we ask people the questions.
I think I'd like to add to this topic as well that we've got to go back to the numbers, and I know that sampling is those methodology, but the numbers we're actually talking about in the original survey is 0.036% of the population of South Yorkshire who responded, and in the second survey to inform the delivery plan, I hope my calculator's accurate and my techniques are good since school, but I make it 0.18% of the population. And if you take out the staff members who responded, the 730 staff members, if you take that out, it's obviously even less, 0.13%. These are minuscule numbers, and I think it does underline Councillor Yassine's point and Councillor Smith's point around how to really engage across the board. It's something I think we've just got to keep on revisiting, and there'll be best practice to learn from, and then and as Councillor Yassine says, investment. But I think those those numbers just bear some scrutiny, really, don't they? I think we need to move on to our next topic, which is about outcomes. Any members' questions about outcomes? Some of the things we discussed yesterday. Councillor Yassine.
Thank you, Chair. When I want to add the caveat that I probably focused on the summary report than the wide report because of timing. So just in case there's things not in here which are more detailed in that report, I'll accept that as a given. I suppose when I was reading the actual plan, I just felt that on certain areas that some really strong stuff was coming out. I can see there was a focus around primary care, understanding what's the average experience out there, people finding difficulty. The main first point of call of accessing healthcare might be just a GP, and you try to focus on maybe some clear messaging and actually going to where some of the demand is coming from. But for me, for a 5-year plan, I suppose, it talks about ambition, but I didn't feel that ambition really came through. And I'm particularly focused around prevention. So when I read the outcomes page, I felt it more demonstrated how do we respond to rising demand, not how do we address the causes of the demand. So for me, I didn't see that part. And that's for me where the ambition is. We lead for over 100 years. We not just got here today, sedentary lifestyle. The whole way we live and work has fundamentally changed. Our healthcare system, unfortunately, hasn't really caught up with that. I felt really strong messaging. We know one, the absolute number one, the research is there. You're all well-read people, and I'm sure you know. Just moving our bodies and fitness, followed by nutrition. That's the most simplest, easiest way if we educate people, support people for the awfulness of how life has become, because we know it's awful because people are dying much younger. They're living with multiple illnesses and really not feeling very well. I felt that I didn't really see come across in that messaging about what is some of those simple things that we could do to turn around the trajectory of where we've been heading for a long time. I saw reports like this maybe 5, 10, even 15 years ago saying we're going to address that. But the truth is, unless we go to the causes of what's making us so ill, actually we're not going to address it because the demand is going to carry on going, and the services, as we already know, can't cope with that because of many of the factors. So I'm sure in some of the detail that you would hope, because I know you mentioned a lot about the wider partnership, so some of that will come through in the detail as the delivery plan comes into place. I would really like to see ambition around how social prescribing is really invested in, getting that community connection. If you just had one big key and just get people moving, like for me, to me that's really, if people think it's simple, I said it's not. Actually, I think would we know if heart disease is mentioned here as one of the big causes. The research is out there, it cuts it by 40% if people actually, their fitness levels went up. So I think if those are some of the messages from a community perspective that I would love to know your views on that. Is that something you're thinking about, but maybe not in this report because it's in the detail?
If I could just briefly respond to that, that's really helpful, and it's just a straightforward answer that you will see some of that in the place plans. So when you look at so behind this joint forward plan, first of all, is some very detailed delivery plans. You would see that in there. It might be helpful as well. I know there's a discussion later on about the work programme. If the Scrutiny Committee would like to have a bit more of a focus on something like primary care, so you can actually get a sense of what's in some of the detailed plans, because you would see that, Councillor Yazine, in those more detailed plans in our places.
If I just make I think it's kind of really seen, like, how do we address kind of the physical and lifestyle issues which are critical factors in health and individual health. So it's kind of seen that coming across really strong, and investment in those areas.
If I could just add to that, as well as the place plans, what you'll find in the full draft of the Joint Forward Plan is that there are some real key areas of focus that is about those modifiable risk factors. So, you know, we know, don't we, what it is that people die of earlier than they should. We know what contributes to that, those inequalities, don't we? We know that they are cardiovascular, cancer, respiratory conditions, and we know the wider determinants and the access to those, as well as the kind of protective factors that make a difference, don't we? And so what you'll find in the Joint Forward Plan is that there's a commitment around smoking, and there are plans to work together to continue to expand our QUIT programme in South Yorkshire. That's working with all of our hospitals. There is a commitment around looking at some of how we take a compassionate approach around weight management services. There is looking at the physical activity element and how we do that with our partners. That features more strongly across into our integrated care strategy. There are some good examples in the Joint Forward Plan of where we're already doing that well, and we need to build on that. So I think from a physical activity perspective, there's the work that's happening, I think, in Barnsley, you know, where you've got a number of partners, haven't you, engaged in physical activity work around to support older people. So there's lots of good things happening that feature in our place plan so that we can build upon. And what we've tried to do in the Joint Forward Plan is think about, well, how do we scale those up? How do we do more? We had a lot of conversation with our partners about ambition, because we absolutely do want to be ambitious, but we're also mindful of the practicalities of some of the immediate challenges we need to overcome as well. And we absolutely heard from people about access to services, you know, being really important to them. So we had to kind of balance some of that out in how we develop the plan.
Thank you. I've got a couple of questions myself here. So something very specific, I have to raise dentistry. It's in a total catastrophic mess. I've fallen off my dentist's list because I haven't been since pre-COVID. I left it because they kept sending emails saying they were still catching up and that routine appointments were not being prioritised. I left it. I missed the one email they sent inviting me to come for my routine checkup eventually. Missed that email and have dropped off the list without any warning. I phoned another surgery, checked on the NHS site which surgeries in Sheffield are taking NHS patients. A tiny number say they are, but when I phoned, the first one I phoned, said, yes, we are taking new NHS adult patients, but there's a 4-year waiting list. I mean, I don't need to say any more about this, but it is in a total pit of despair. And Health Watch in Sheffield conducted an exercise last year. I think it's about 18 months ago. They conducted an exercise where they phoned every surgery in Sheffield, and there wasn't a single surgery taking NHS patients at that point in time. And obviously that was still COVID recovery, etc. But, you know, there was my surgery said that I could go back on the list, but there was a waiting list of 2,000 people. So we are grossly under-resourced, and I've no doubt this is the same in Rotherham, Barnsley and Doncaster. So I don't want to put you on the spot today, but can you please go away and come back with something really robust to deal with dentistry? It gets a mention in the report. There are ambitions to meet a target, but it's so far from being met, I can't see how you can get there. So with looking for a nod from other members, I think we'd probably all like to hear what the really robust plan actually is.
Thanks for that. We can absolutely, can't we, take away in terms of that's an area that you would like to learn more about. We have had feedback over July from a number of places around strengthening dentistry in the plan. So we have been in touch with our leads, because from a dentistry perspective, we do work with the other systems across North East Yorkshire, and there are plans under development around the workforce plans, working with local authorities around oral health, so some of the preventative aspects as well. But we can absolutely take that away that you would like, almost like a bit of a deeper dive into how the plans are developing around recovering access to dentistry.
I'm just going to look at my colleagues for consent. That I think it would be a good idea to ask for more detail on that. Would that be acceptable? If we can note that as a recommendation. And further, just on outcomes, so I'm going to take some of the words from the report, which says that we need to be relentless and creative to prevent ill health in the first place. No one's going to argue with that. But also continuing the progress made in delivering the key ambitions set out in the NHS long-term plan. Understand that that's necessary, and transforming the NHS for future generations. And I just wonder whether there's any sort of conflict or competition between those priorities in terms of resources. So do those things dovetail, the ambitions to get further upstream with prevention and health creation, I think is a good term to look at as well. And, keeping people in a situation where their life circumstances keep them away from needing healthcare for longer. Does that dovetail with the NHS long-term plan commitments that you've got? Does it dovetail with transforming the NHS for future generations? Or are there conflicts there in how you can disperse the resources that you've got? And when you're thinking about transforming the NHS for future generations, do you believe that the direction of travel is sound and appropriate to fit with the ambitions and priorities that we've got in this plan? I just want to sort of make a little example of several years ago there were outlined plans to reconfigure maternity services across South Yorkshire, and those plans were started under the sustainability and transformation plans. So that terminology seems to have disappeared, but were subsequently dropped. Nothing happened. What was wrong with the transformation plan that meant it was dropped? I mean, I personally think it was wrong, so I'm glad it was dropped. But, it was started and dropped. Is the direction of travel good and sound? The transformations that you're being asked to make, does it fulfil the ambitions of the plan that we've got here?
I'll have a go. I think ultimately there is some conflict, because there's a conflict even in priorities, and I think we recognise that the plan is hugely ambitious. But we also recognise we're in a situation where certainly the NHS and social care and wider is still both dealing with COVID and also recovering from the impact of that. And if you go into any of our services, you'll be able to see that. So there's no doubt that we've absolutely got to recognise that and recognise that in our plans as well. And that's important for our communities and people, because actually they do need to access services now. And I guess there could be a conflict of that with trying to get more upstream. So there absolutely is a commitment, a vision and an ambition to be more preventative. Why wouldn't we? And that's not just the NHS. We recognise that in order to do that, we need to work with local authorities and wider partners in order to do that. So I guess where I am, I'm in a place where I see all of that. I get the challenge, but it doesn't stop us from being ambitious for our public. We need to be. We're going to have to do many things at the same time. We won't do all of them well, and we won't get all of them right. But that's the nature of being ambitious. I think we've set out some fairly bold ambitions, particularly in our strategy. I think the thing that might be different, that might help us, is part of the fact that there's been some big structural change. Well, there has. And it depends on how you view that. So CCG's moving to NHS South Yorkshire and being a South Yorkshire organisation might be seen as, what does that really mean? But it really, I suppose in some ways, what it does mean, it means that actually you give more autonomy locally to work out actually how things need to be done locally. It does mean that where we need to act together, we can act together as one, and therefore that might actually be better for our public as well. It might be more efficient. But I think ultimately, what it probably does is allows us to work better in partnership with others. And I think what we all know is actually where you get great and amazing things and different outcomes, and you can be more creative. And I quite agree with Councillor Yazine's point around we need to rethink how we do involvement and engagement. We absolutely do. But I think some of that rethink comes from where is that already strong, and where is that already strong in places where we perhaps haven't seen that before. So Councillor Ennis, you talked about aspects of the social care sector, and I don't think we really work with them terribly well. And therefore, there's an opportunity, because all of that is recognised, so there is an opportunity for us to perhaps do something different this time. On the specific point around maternity, you'll see within the plan there is a focus around that, so that's not gone away and it's not been dropped. The actual specific transformation might have been, but actually the priority hasn't, and we still recognise that there's still work to do in that space. So the work is continuing, but actually it's continuing in a way that makes sense now, for our population.
Thank you. Are we happy to move on to our next topic, members? So primary care. Obviously it's quite a big area, isn't it, primary care? So councillors. Councillor Smith.
Yeah, we discussed this yesterday at the briefing, and that there are some obviously poor figures on access to primary care, and we did that there was a view that it isn't just about access to primary care, and I absolutely get that, and I'm not saying our GPs aren't working the socks off, because we know that they are, but the ordinary folk out there will tell me at every opportunity I give them that they can't get to see the GP. So it's kind of how we solve that problem. And the other thing that I've realised since retirement, because I think I've lived in a bit of a bubble where I, as an expert, liaised between services. My experience since leaving the NHS is really, if you can't articulate your need, currently you're struggling a bit. And we really do need to do something about that, because, the person who struggles without a face-to-face and who can't articulate what their health issue is over a telephone, things will get missed. And I also get that we're catching up on, a long period when we weren't able to see people. And I think we're catching up on things that have moved on apace as a result of them not being picked up in early stages. But I have some big worries about people who can't articulate their needs currently in our primary care system.
Yeah, but I just wanted to raise something about channeling resources into primary care. I've recently spent time with quite a large number of GPs in Sheffield in a series of workshops they've undertaken, looking very closely at the future of general practice and more widely primary care. They've been extremely constructive and well constructed by Primary Care Sheffield, and I think it's been a really useful exercise, and I think there's going to be a report coming out of that. What I heard a lot around the table, I was there mainly to listen, what I heard a lot around the table was about shifting resource. And I guess if you speak to any part of the healthcare system, including social care, each part of it would say you need to shift resource towards us. So fair enough. But I think there is a fair point there that, there's a lot of innovation, I think, that practitioners would like to develop within primary care and don't feel able to because of lack of resource. I guess my question really is there enough resource to start shifting from one place to another, or is it just robbing another part of the system? And what are your particular sort of feelings about shifting more resource to primary care and more upstream than primary care to help with the prevention side of things? I guess I'm asking what your plan is in terms of the resource that you've got and where it might be best directed.
I'll start if that's okay on that one, because I think it's a really important point, because there's never enough resources. Even times of plenty, there's never enough resources. At this moment in time, there aren't enough resources. The obvious point is it's really clear within our strategy and our joint forward plan that there is a massive commitment to direct resources to where there's most need, and indeed to try and direct resources to focus on much more preventative upstream. Primary care is a huge part of that, and I mean primary care in its broadest sense. So I'm echoing what's in the plan. I think so how do we start to bring that to life? So you'll start to see some of the work coming out from the work that is happening in each of our places. So where we as the NHS, as the ICB and wider partners are working together and really starting to target. So when we describe most needs, so where are our communities then where we can target most need, and then really think about what is actually most helpful to invest in those communities, so we can really test out, where is the greatest impact going to come from. So you'll start to see that, and it might be helpful. I'm imagining, but you'll tell me or not, when you're in each of your places and you're working as part of your role in local authority, you should be able to see some of that coming through in the work that you are scrutinising there. But it might be helpful to see some of that in this space as a joint overview and scrutiny committee, because you'll see that our plans will start to crystallise over the lifetime of the plan to be able to bring that commitment and ambition to life.
Do you want to speak? Oh, I was just going to come back to see we've had a little dollop of investment, £37 million to Sheffield for improvement to the primary care estate. We've got 3 new hubs coming in North Sheffield and a city centre hub in the pipeline. But recently I've asked about how the money that's been awarded there, what value that money has. I guess we're 18 months on from when we first sort of started seeing these plans, and the value of things is different. So the cost of everything has escalated. And sadly, some of the things we were looking forward to most in that transformation look like they won't happen. So community diagnostics, for example, that's going to have to be scaled down. So the use of these new hub buildings is already, before they're even built, depleted from what the original hopes and plans were. And I just do fear with, when we're talking about resource in terms of money, that really there's a lot in this delivery plan that's, we really want, but it's just going to get harder and harder to actually deliver on it. So it's just quite a sad example, really, where, in our scrutiny committee in Sheffield worked really closely with the NHS and our other parts of the council to develop the best possible outcome that we thought for this transformation, and then it's already started to collapse. So I just wanted to flag that up, that, yes, it does all look really quite exciting on paper, but it doesn't always follow through, sadly. Is there anything else on primary care? Yes, Councillor Lucy.
I don't know if it's within primary care, but I think it fits this section better than the others. I suppose it's your role around you as an influencer. You've got a whole hybrid of diversity of services that come into play at different parts of an individual's access to healthcare. And I think that's something for me is what do you think about your role of influence? So I'm just going to pick up the example of access to dental care that the chair referred to. Like most places, we are very concerned about access to dental care. In Rotherham, we invited the NHS Yorkshire and Humberside. I think it's like a board that sits there. There was a 50 million budget that was about creating greater access, and I think it was pretty much about where the need was. But interestingly, when we invited them to the meeting, any simple questions about how did they decide where to invest that in Rotherham is probably one of the most shocking experiences I've had with a public health body in terms of how they decided on what their strategy was, where to put that investment. So it was very haphazardly done, not necessarily a high concentration in one part of the borough and hardly anything in the wider echelons of Rotherham. Also, it wasn't really based upon need. So I think for me is your role about influencing, because that for me would have been a great investment, and attaching it as that service got its strategy right, or where it's going to put the whole point. This was additionality. This wasn't usual funding. So really that should have had a focused outcome about shifting something in our local areas. The other example is health by lots of councils are always used as an outcome in so many strategies, and some of it's really good, but sometimes it's not. And when I question them, so in a good example for me locally, I won't mention Sheffield, I won't mention anywhere else, is for example, cycling routes, the new cycling developments. There's actually almost very little evidence that you build millions and millions of pounds of physical infrastructure that's going to lead to all these health outcomes. The real health outcome is about investing in culture, about prevention, getting people moving, which is walking is the most simplest and but almost free. So it's about your role, how are you influencing your wider partners to help with the determinants of positive health for people. So that for me is, I'd like to know your view about how you strengthen your role as an influencer.
They're great questions and great points. Can I start on your first one? Because I have to be completely honest, because I don't know anything about the details, so I can't comment on the detail. But I think there's already a commitment. I think there's always an ask, isn't there, from the Scrutiny Committee to bring something back on dentistry. So I think that might be helpful. But I just wanted to raise awareness, if it's not already, from a local perspective, so an NHS South Yorkshire perspective. We've just become the Commissioner of Dentistry Services this year in April. Everything you say is recognised, absolutely recognised. So really, trying to get on the front foot with what essentially is a new responsibility for a new organisation. So if it's, and I know nothing about the 50 million, so that, and it probably predates, but I absolutely take your point. It's an amazing opportunity on the sounds of it, and actually we do need to understand how that makes the most difference, where it needs to make the difference, so recognise that. But I think trying to work that through in the focus on dentistry is probably the best place to do that. I also agree with your wider point around whether it's investment in infrastructure or investment in simple things that we know work, and I'm on the side of that. I just thought it would be helpful just to, we are all, so local authorities and the NHS and others are all part of the Integrated Care Partnership. And one of the big focuses within the strategy that Marianna looked at there is culture, and the impact of culture and some of those simple things, some of the preventative things on ultimately our health and well-being. And particularly the well-being part. You asked what our role is. So our role is about how we as a South Yorkshire organisation support convening that space and bringing partners together to have what essentially are the right conversations to get us in the right frame of mind for what would be most impactful. We had a fantastic session at the last meeting on culture and the impact of that on health, with some amazing examples of really simple things. So I'm only supporting what you're saying and committing that as an NHS South Yorkshire, we are absolutely doing our part in bringing those conversations together.
Thank you. Just to say 50 million was not for Rotherham. I don't want people to get carried away. It was a national budget. We had a small part of it. And just also to let you know, the 50 million wasn't even fully spent. So it shows the inefficiency where the investment was given for need. And I think it's about how you carve out, how do you influence that investment to make a difference. Thank you.
I'm going to move us on a little bit. I think in view of time, because we want to allow time for Professor Layland to speak about the ambulance service as well. So I think when we come to the impact of the 30% operational cuts, I think maybe leave that to a future discussion, because I think that warrants its own discussion. But I would like to touch on workforce strategy and the COVID and preparedness for winter. And in that, Professor Layland, I think we might like to bring you in on that as well, because this obviously is quite a big area for you as well. Workforce strategy, I have to mention the industrial action and the fact that this comes through in reports. We had quality accounts at Sheffield Health Scrutiny recently from Sheffield Teaching Hospitals and the Children's Hospital. They both mentioned in one line the unprecedented level of industrial action, but there was no response to that. And I guess it's very, very difficult from managerial positions to respond to that. And it's a governmental response more than a local response, but I think, you know, we can't sideline that aspect when we're talking about workforce strategy here. And I guess I'm going to feed you my own opinion and respond if you're able. But you know, there's no point talking about anything to do with workforce unless people working in the system feel they can stay in the system. So if we're constantly leaking because people are dissatisfied with their pay and or working conditions, it's a hiding to nothing. So it has to be addressed. And we're waiting for, you know, we wait for a governmental response to all of this at the highest level. But actually at a local level, there's a leaky bucket constantly. So I wonder what your response to that is, if you're able to comment any further about that. But I understand if that's a difficult area to delve into.
It's difficult to respond on the start of that point, but I would agree with you that fundamentally any workforce strategy has to be focused on actually retaining what is essentially a valuable workforce, that without actually, you know, particularly from an NHS perspective, the NHS actually is its workforce, isn't it, in many respects, and the people that it serves. So I fundamentally agree with that point. And the essence of certainly the strategy at the moment, notwithstanding from an NHS perspective, there is a national workforce strategy, which will be discussed both at the ICP and also in our boards in September and coming months, is all about how we absolutely support our workforce in every aspect, including their health and well-being. But I don't feel I'm able to comment on the initial point around the government response to the current industrial action that we've had over the last 9 months, only to say that actually that, you know, that is impactful, recognise that it's impactful all round, and I think what you're alluding to is the impact on ability to deliver services, which we also recognise, and particularly in relation to some of the backlog. But I'm just trying to respond to your answer in a way that I feel able to.
I appreciate it, thank you. Any other questions around workforce? Professor Layland, I don't know, would you like to comment on this? Because there's been industrial action within the ambulance service, and maybe comment on the impact that that's had and the kind of solutions that you see that would help to make your workforce resilient.
Yeah, thank you. So as members will be aware, last year we had ambulance industrial action, and there is one trade union that is still ongoing in their dispute with the government. We have worked very closely with our trade union partners to mitigate that impact on patients locally, and particularly as the recognition is it's not industrial action against us as an employer, as in Yorkshire Ambulance Service, but wider against the government and the NHS as a whole. What we've been able to do locally is put in some solid plans to make sure that our workforce are protected and supported with their right to take industrial action, but also for them to recognise the impact that that has on patient care. And the majority of the workforce that were taking part in industrial action did do under the mitigation, so they were permitted to respond by the unions for certain categories of calls to our highest priority patients. And of course we then bolstered resources in different ways to support those lower priority patients so that they got the best response that we're able to provide. I think moving forward, and on your point of workforce and retention and recruitment, it is an extremely challenging area, and as Will pointed out, our workforce are the most valuable asset that we've got in the NHS overall. And as a whole, we've got to think about how we support them, not only through their health and well-being, as Marianna said, but the education that we can provide them to meet the needs of patient care today. You know, we often think about, I'm a paramedic as well, so you know, my training at the time was for patients at that time. You know, and patient needs and the population has changed as a whole, and that's where I think the Joint Forward Plan and the work that's been done to identify our outcome priorities can really resonate with our workforce overall, but we need to be able to support them to deliver that in a really efficient and productive way. And of course it doesn't help when we see in the media that the NHS is struggling. It absolutely is, but it's still, from my perspective, as a clinician as well, one of the best jobs in the world that you could possibly do. So I think we need to promote that more, and the committee's help with that would obviously be really welcomed.
Thank you. Anyone else? Financial pressures, I think we ought to sort of remit that to another discussion. But if we can perhaps just briefly touch on COVID and preparedness for the winter. So I think, Councillor Ennis, did you have questions around this?
Yes, thanks, Chair. I mean, given the two questions you've already put in, we've got rigid commissioning arrangements for flu and COVID boosters, making it hard for some vulnerable people, such as the homeless and migrants, to access them. What plans are in place to ensure these health groups can access them, given that they experience the greatest inequity when it comes to health outcomes? They're some of the most vulnerable. And the further point I'd like to make, I've heard talk in the media that pharmacies will, because of the tight constraints on the flu and COVID jabs, pharmacies will be able to provide injections to the wider public so long as they're willing to pay. Now, I don't know if that is a realistic option. If it is, I'm assuming that we would support that particular option to try and get as many people injected as possible.
So we've got a good track record in South Yorkshire, haven't we, at supporting kind of vaccination across our patch. So what we're really keen to ensure we do is to learn from what's worked well in terms of where we've reached out to some of the communities that it's harder for us through kind of conventional delivery to support them to access their vaccines. We did very recently get our kind of winter letter from NHS England, which is about us starting to set out the plans we put in place to have a resilient, sustainable service over winter. Some of the specifics around what that means in terms of the delivery around some of the flu and COVID vaccinations will differ a bit in each places, because it'll build on some of the approaches you've taken today. What you've learned works, and so that might be a question that's quite helpful to ask to some of your place colleagues. You mentioned community pharmacy, and I think there's an acknowledgement, and that's within the Joint Forward Plan as well, about the opportunity we have for engaging further with the community pharmacy workforce to support frontline delivery, being such an accessible community resource, I suppose. And so, in some cases they did deliver some of the COVID vaccinations, didn't they? It differed a little bit across the patch and some of the arrangements. So I can't comment specifically on the Barnsley, what's the plan to deliver in Barnsley. What I can say is that there will be plans that are being developed and that they will build on some of the learning from what's worked well.
If I could add to that as well, the involvement team at NHS South Yorkshire had a discussion on Monday about this and about how we could learn from the role that we've played in the past in terms of making sure we reach into our most vulnerable communities and hear from them about how we can ensure that we support people to get the vaccines that they're eligible for. We've got some ideas that we plan to take forward, building on things that we've done before, working with the community teams from the council and working with the VCS organisations as well, to make sure that and what we do is, you know, like you say, there are rigid structures, but we do make sure that that feedback goes back to them. And you know, I've got an example of last year where we spoke to a mum of a child with a genetic condition who has also got learning disabilities and had COVID vaccines prior to last year in the Sheffield Children's Hospital, where he was supported to feel much more enabled. And the expectation early on last year in the vaccine round was that he would need to just have it done at the pharmacy or the doctor, because that's where it was offered this year. And so we made sure we fed back that that simply wouldn't happen for that child, and he probably is indicative of a number of children. And actually then there were some changes made, and he was able to, you know, get his vaccine in the hospital. So we do make sure that where there are real barriers in our commission, that is fed up, and hope that that affects change.
Could just come back briefly, Chair. This is an area of strength, certainly in Barnsley, the way we've carried out injections in the past to the wider public. We've been very successful in that. Just to underline that, I got a phone call from my local surgery last week. I've already got my flu jab booked in for the end of September. It's already arranged, and for my wife as well. So that's just an example of how well we do things.
Thank you. I just want to summarise some of what we said by just underlining that we keep coming back to resource, and we're all conscious that there isn't really enough resource to fulfil everything in the delivery plan. So it's, you know, I wouldn't hold back on praising the sentiment and ambition in the plan, but I do very much doubt whether it's deliverable. And that does come down to resource rather than strategy, I think, in my opinion. I mean, to what extent are you able or prepared to push this back to the source? You know, if there isn't enough resource, are we just trying to manage that situation within South Yorkshire, or are we making an ask, you know, of the department and of NHS England? Are we making that ask? Are we saying this is the plan that we've genuinely devised based on the needs of South Yorkshire, but we can't deliver it? Are we saying that? Or are we just kind of going to try and struggle ahead with the plan, knowing that it can't all be fulfilled?
Can I just respond to that? Because I'm not sure. I'm not sure that we're sitting here saying that we've developed a plan that's not deliverable, because I think it is. I think we have set out a plan that is deliverable in terms of the vision and the ambition. I recognise that resources. I've worked in the NHS a long time too, and I'll declare that I'm a nurse by background, so I've worked in the service. So I recognise that question around resources is always there. Where it's appropriate, of course, any organisation would reflect some of the constraints of a plan. But I wouldn't want to think that we were here in some sort of dead water, setting out a joint forward plan, knowing at the outset we can't deliver it. I don't think we're in that space. I think we're in a space where we've set out a plan which has got vision and ambition and a set of priorities and commitments that are deliverable. Remember the joint forward plan, there's an opportunity for us to be able to update that plan. Mostly because actually we need to make sure that from our people and communities perspective it's still relevant, so it's the point around maternity services. So there is an element of us having an opportunity to do that, and things change. So this is a forward-looking plan, and it's important to be ambitious for our population. So I think we're in a space of it's tricky, the money's tight, we've got efficiency plans, they're not efficiency plans that reduce quality. They're not efficiency plans that take away service, but mostly about how we do things more efficiently and how we do things better together. So I think we're in that space.
Thank you. Any final comments? Because I think we want to move very quickly on to our discussion with the Yorkshire Ambulance Service.
It's just a small point, really. Just to echo what the chair's saying, I mean, we're not going to go into 30% cut, but I think it's like council and austerity. We can't carry on having that level of loss of investment in local services and local people and then say we're carrying on doing as per usual. It does not make mathematical sense for us to say that we can do that. But I appreciate the pressures upon yourselves as a service. We're elected members and we're local politicians, so we can be a lot more straightforward. For me, a clear recommendation, and I don't know, in Rotherham, as part of our role as Scrutiny, we do write to various government agencies, is that we think this is an unacceptable cut to these services, and I think that it will have a detrimental impact on the vision that we have in supporting local people's health and well-being. So that's, I mean, I feel really strongly about that. But I'll leave it at that. I think you kind of summarised what you said earlier as well, but I just don't think it's acceptable for us to carry on with the level of increased demand on services and the issues that we already discussed.
Could I just come, because I really sort of value that reflection, feedback and support, but it was just a clarification on the 30% cuts, just so that we're absolutely really clear. It's not a cut to services. It's a cut to the management resource that NHS South Yorkshire, as fundamentally a commissioner of health services for South Yorkshire, is having on it. So you're right, our ability as an organisation to be part of the delivery of that plan is going to be curtailed. So it is going to be more challenging. We are going to have to do more as an organisation. There's no doubt about that. But I just want to it's not cut to services. So I think that message is very different, and I just wanted to make sure that everybody understood that particular point. But thank you for your support on the 30% on our organisation.
Thank you very much indeed for all your input and for tolerating our questions and providing so much more fulsome information. So we've been asked to provide feedback, which we've done in our questionnaire. I think it might be useful if we summarise that and formally send that to you in a document for the record. And regarding Councillor Yassim's suggestion that perhaps this committee might take that feedback further and provide it back to the Department for Health and Social Care, how do members feel about that? Are we? Yeah, agreed. Okay. So I think if we can agree the wording of a summary post this meeting, but if we've agreed within the meeting that we'll take that action. Thank you. Okay. So swiftly on to item 8, which is a very brief report from the Yorkshire Ambulance Service NHS Trust. Thank you again, Professor Layland, for attending. If you want to just briefly outline why you've come with this to this committee, and then we've got a short time left for discussion. Thank you.
Thank you very much, Chair, and thank you to Deborah and the committee for inviting me along today. As an ambulance service, in your local ambulance service, we introduced a new role last year, which is my role as System Partnership Director, to have a much better strategic relationship with our health and care providers across Yorkshire and the Humber region, but my specific focus is in South Yorkshire. And the role was put in to not only engage, but to transform services and have better strategic planning of our services moving forward, and working extremely closely with my colleagues from NHS South Yorkshire, both at place and system level as well. Just as a reminder, some people don't always realise this, but Yorkshire Ambulance Service not only provides the 999 response in the area, but we also provide all of the 111 services and the patient transport services. That's taking people for outpatients appointments to hospital discharges and renal patients as well. And in the South Yorkshire area, we host the Embrace Children's Service in partnership with Sheffield Children's Hospital, which provides immediate critical care to children and young people across the Yorkshire and Humber region. So my role has been to properly embed into place system and with all of our partners across the health and care landscape, including the police and fire services and the voluntary and charitable sectors as well. And we have recently been involved in the support of the NHS South Yorkshire Joint Forward Plan specifically for urgent and emergency care. So I was really pleased to be invited today and to reach out to the committee, because I feel that there is an opportunity for Yorkshire Ambulance to engage further with the committee in the future to help your ambition of providing the best care to patients in South Yorkshire. And of course we are a significant contributor to that care overall. And so my proposal to the committee is if you are acceptable to have Yorkshire Ambulance Service attend at least twice a year in the committee to give an update on the work that we're doing, obviously to be appropriately scrutinised for that work as well. But we have an annual quality report which we would value the feedback on the committee on a regular basis. I know it probably goes to other committees in South Yorkshire through Health Watch, etc. But I think having this forum is really helpful for us to hear that impact back on quality. And likewise, you know, we would be very keen to support the work of the committee in any way that you feel possible, whether that's as an advisor or to bring things for the committee's attention and scrutiny as well. But just thank you very much for allowing me to attend, and yeah, anything we can do to help, we'd be very keen to do so.
Thank you, that's excellent. In terms of your new strategy, do you want to just pad that out a little bit for us, so give us a bit of context of where you're coming from, why there's a need for a new strategy?
Yeah, absolutely. Apologies, I completely forgot about that point. So our current strategy was 2018 to 2023, so it's come to its natural expiry as a strategy. And of course, as we've discussed today, there's been some significant changes in the landscape of health and care with the introduction of the integrated care boards, the integrated care partnerships, and our work at place and system level overall. And so it's right, not only through the expiry of the current strategy, that we start to reflect what the future of the ambulance service, and as I say, your ambulance service, needs to look like moving forward over the next 5 years. So that work is just commencing across the ambulance service to start off with, and then we'll be coming out to wider engagement early next month and throughout the month. We have an event scheduled on the 26th of September in South Yorkshire, which I'll make sure details are all shared with members, and of course any dissemination of that will be extremely grateful for. But it's that huge opportunity now to actually transform our services for the future and to think about that patient need right now, and also what the art of the possible is from an ambulance service. You know, we've got those 3 services that we cover, but that isn't all we do. We integrate very closely with primary care. We integrate very closely with our hospital trusts as well. And as Will was saying earlier around the delivery of the Joint Forward Plan, we've got a huge role to play with that, and also recognising where we can play that role and what the feedback is from the public and our experts associated with that. And finally, just on another point that you raised, Chair, a while ago, and Councillor Ennis raised about those health inequalities, we are uniquely placed in the work that we do as an ambulance service to support the improvement of health inequalities across South Yorkshire as a whole. We've recently embarked on refreshing all of our data and sharing that data so that we have a better understanding, and we can share that with anybody who wants to see that, to impact on patient care. So the strategy is very much a great opportunity for us to completely think about what services we can provide over the next 5 years and where our ambition can align to the Joint Forward Plan as well.
Thank you ever so much. Any questions, members?
I think one of the questions would be, I welcome that you're going to come to this meeting, because I think it transpired in preparation for this meeting that Yorkshire Ambulance Service really only comes to Rotherham Scrutiny. We don't know if it's this kind of historical anomaly, not that we're special, but so I think the idea that, because the report was very much, I would say, a Yorkshire-wide report, so it was really hard to kind of pull the figures out that were relevant to us. I think this is a better place for that quality account. But I think reading the quality accounts for a number of years now, it would be amiss of me not to say that, you know, you've got a lot of work to do. So that strategy, you know, it's failed in all its national targets. And for us, we did give the feedback in the quality account, is about how you're representing the solution-led approach, because we know what some of the problems are, because we get that feedback from residents. And I think that's one of those other areas, isn't it, where you're more likely to come in contact, if you're generally a healthy person, is actually the ambulance service, followed probably GP being a close second. And if those experiences are not positive experiences, that's where you sometimes see that huge amount of negativity. I think really about that's what I would like to see when you come to us future meetings, how you're addressing some of those missed targets and how, what do we do collectively? Because sometimes maybe the ambulance is not always the right point. I would argue that. From a personal perspective, I've had personally the best experience on my father, which is the irony when I was reading reports. So it's interesting, it's a very hit and miss across, not just within Rotherham Borough, but actually I think it'd be hit and miss to understand that wider geography as who's really been able to access the service and who is not. So I'll leave it at that. You've got a copy of our quality response anyway, quality report response. Thank you, Chair.
Yeah, thanks, Chair. Coming from Grimethorpe, I'm a proud Yorkshireman. And my wife's from Grimethorpe, she's a proud Yorkshire woman. But Yorkshire is a fantastic place to live, but it's so diverse, even in South Yorkshire diverse. But when you look at the whole of Yorkshire, it's even more diverse. And we're very lucky to have the centre of Yorkshire Ambulance Service just over the border in Wakefield, isn't it? That's right, Adam, isn't it? So I think that's a big advantage for South Yorkshire. I know it's not in West Yorkshire, but it's so close to Barnsley in particular that I see that as a positive advantage. But I'm just wondering, because it's such a big, diverse area, does that add extra pressures to the service, or is it a question of learning by best practice model in Wakefield or wherever, in North Yorkshire or wherever? What's the strengths and disadvantages of representing such a big, diverse area as Yorkshire?
No, I think it's a really good question, Councillor Ennis, and that's the approach Yorkshire Ambulance has been taking with the introduction of my role, so that we can have better representation in the areas and to mirror the ICB and the integrated care systems as a whole. Of course, there's some great efficiencies from having a larger geographic service on behalf of the NHS. It means we can put more money back into patient care rather than administrative costs as a whole. And of course, ambulance services were regionalised in 2006 overall to do that, and that's definitely had some major advantages. In addition to that, across the wider geography, we have a Northern Ambulance Alliance. So that's an alliance between Yorkshire Ambulance Service, North East Ambulance Service, North West Ambulance Service and East Midlands Ambulance Service now, and we work on larger scale ambitions. So for example, our fleet, very similar. One of the biggest costs for an ambulance service is our fleet. So having that standardised, having a better procurement ability to get better efficiency for the taxpayer, it's got those benefits overall. But of course, as you mentioned, there are disadvantages to being so big as well, and it's having that ability to be reactive to those local needs, not at a system or a place level really, but more at a neighbourhood level. And one thing I'm really passionate of, and I know the wider ambulance service, and this will be reflected in our strategy, is despite our size, we're still a very local service. We're a local service delivered on a regional footprint. We've got 11 sites in South Yorkshire, so we are very much about that locality, and if that's a word, locality. Of course, our workforce lives in the areas that they work as well. So we are fulfilling that ambition to be a much stronger anchor institution, recognising the impact that we have at a neighbourhood level overall, and we want to do more of that, hence why we've got the opportunity through our strategy.
Thank you, and a sincere thank you for all that you do, especially when circumstances are trying every winter for you, and with the industrial action issues that you face. So sincere thank you, I'm sure, from all of us. Are we happy, members, to go ahead with the proposal made by Professor Layland, and so to receive reports from you a minimum of twice a year to this committee, and to interact with you as to your forward-going strategy. And you said one other thing, to bring the quality account. That's right. Yeah? Are we agreed on all of that? Thank you very much, members. And thanks again for attending. Okay, we've just our work programme left to discuss, I believe. I make it on my timer that we have 10 minutes left. So let's see if we can do it in a bit less. So our work programme is on page 35 of your agenda pack. At the moment, not heavily populated. Going forward, I think from today we've identified that we'd like a separate session to look at the impact of the 30% operational cuts within the ICB, if that would be acceptable for you to come back with something on that, and to receive something back specifically about dentistry. We have the oncology review, which is due at our next meeting in September, and apart from that, it's open to members to bring your priorities forward. If there's anything today, or we can come back to this later.
I'm happy to contribute over the next few weeks with some ideas.
Katy, yes.
Sorry, the Cancer Alliance had asked me to bring to the committee the proposal that the oncology review is moved to the October meeting because of changes. They feel, I mean, they said they were happy to bring an update in September if you still want them to, but in terms of the decision making in this committee about consultation, they feel they're more likely to be at that stage for the October meeting.
I feel like I'm going to put my opinion forward. I feel like this has been pushed down the line a few times, so I think we might prefer to hear it sooner rather than later. And if it's, you know, if it's a work in progress, that's fine. But I think we might want to keep involved along the way rather than just wait till there's a finished article. Members?
I would agree it's being put back, but I'm conscious that there are some specific issues in Doncaster that I would have liked as soon as possible, but you know, I'll go with the decision made by everybody.
I'm happy to support the chair's view.
Sorry, we're still on oncology, Chair. Oh, it's okay, I wanted to raise something else.
Okay, so we'll bring that to the September meeting as planned, if that's all right, and we'll leave space in October as well. Okay. Councillor Ennis?
Yeah, I mean, obviously, it's very important that each individual place overview and scrutiny committee works in unison with the Josh, as it were. And from that perspective, I think it would be useful if Josh could provide us with their work programme for the next 12 months, for example, with having sight of that, so that then we could plan our own work programme of issues to be considered, flowing from Josh at our own overview and scrutiny committees at an appropriate time. So it's just a request for that, Chair.
I think we may have asked informally before, but I think it might be useful to ask from the ICB for an outline plan of any changes or transformations that are in the pipeline to help inform our forward plan. Specifically, if something specific to place, obviously that goes to place. but I think that might be useful just to get a sort of top-level headline report from you about what you've planned ahead for this year. Yeah, agreed. Thank you. Right, I think that's taken us as far as we can today with the work programme. All right, we'll make efforts to populate that a bit further ahead. Professor Layland.
Sorry, if it's helpful for the committee and the October meeting as well, I'm happy to bring the YAS strategy to that meeting. We'll be near the end, but we've still got a month before it's finalised, so if you would like that.
Yeah, sorry, which committee were you referring to?
Sorry, back to this committee in October, Deborah.
The date. So were you?
October.
Oh,
October, sorry.
Yep, that's useful, thank you. Okay, so I think that sees us fairly well organised for the next 2 months ahead. Right, I think that brings us to the end of our business, apart from the date of the next meeting, which is on the 21st of September at 10 a.m. in this chamber. Thank you very much indeed once again, all members and participants, for all your input this morning. Thank you.